Hello and welcome. Today we're delving into a rare and complex congenital condition known as bladder agenesis. This condition involves the complete absence of the urinary bladder at birth. Join us as we explore its cause, effects, diagnosis, and management. The precise cause of bladder agenesis remains largely unknown, although it's generally believed to arise from disruptions during embryonic development. During the early stages of fetal growth, the bladder develops from a structure called the cloaca. If this process is interrupted, typically between the 4th and 7th weeks of gestation, the bladder may fail to form completely. Genetic factors are suspected to play a role, but specific genes or mutations responsible have not been definitively identified. Environmental influences, such as exposure to certain toxins or teratogens during pregnancy, are also hypothesized as potential contributors, although conclusive evidence is lacking. In most cases, bladder agenesis is considered a sporadic event, meaning it occurs randomly without a clear family history or identifiable cause. In the absence of a bladder, the urinary system faces significant functional challenges. Typically, urine produced by the kidneys would be stored in the bladder until it's voluntarily emptied. However, in bladder agenesis, this storage function is lost. As a result, the ureters, which normally carry urine from the kidneys to the bladder, often drain directly into other structures, such as the urethra rectum or vagina in females. This abnormal drainage can lead to continuous urinary leakage, increasing the risk of urinary tract infections and potential kidney damage due to the reflux of urine back towards the kidneys. The lack of bladder capacity also disrupts the normal mechanisms of urinary control, resulting in incontinence and associated complications. Bladder agenesis is an exceedingly rare condition. Due to its rarity, accurate epidemiological data is limited. It is estimated to occur in fewer than 1 in 1,000 live births, making it a truly exceptional occurrence. There doesn't appear to be any significant gender or ethnic predilection. It seems to affect males and females and individuals from various ethnic backgrounds equally. The signs and symptoms of bladder agenesis are usually evident shortly after birth. The most prominent symptom is continuous urinary incontinence, meaning the infant is unable to control the flow of urine. Instead, urine constantly leaks from the abnormal opening or connection where the ureters drain. This continuous leakage can lead to skin irritation and infections in the genital area. Other potential symptoms include frequent urinary tract infections, abdominal distension, and, in the long term, signs of kidney damage or dysfunction. Because the bladder is often involved in supporting the pelvic floor, other abnormalities of the pelvis may be present, such as prolapse of the rectum or uterus. The absence of a palpable bladder upon physical examination can also be a clue to the diagnosis. Diagnosing bladder agenesis typically involves a combination of clinical evaluation and imaging studies. A physical examination may reveal the absence of a palpable bladder. Ultrasound imaging is often the initial diagnostic tool, which can confirm the absence of the bladder and assess the condition of the kidneys and ureters. More detailed imaging studies, such as voiding cystoarthrogram, VCU or magnetic resonance imaging, MRI, may be performed to delineate the precise anatomy and the point of drainage of the ureters. Cystoscopy, a procedure involving the insertion of a small camera into the urethra, may also be used to visualize the lower urinary tract. Prenatal diagnosis is possible through detailed fetal ultrasound, although the rarity of the condition can make it challenging to detect before birth. Bladder agenesis is typically not classified into different types. It fundamentally represents the complete absence of the bladder. However, the specific anatomical variations in the drainage of the ureters can differ from patient to patient. For example, the ureters may drain into the urethra, rectum, vagina, or even into a persistent cloaca. These variations are considered anatomical differences rather than distinct classifications of bladder agenesis itself. The treatment and management of bladder agenesis are complex and require a multidisciplinary approach. The primary goal is to establish a method for urinary diversion, meaning to redirect the flow of urine away from the kidneys and allow for controlled elimination. This typically involves surgical intervention. One common surgical approach is creating a continent urinary reservoir, a pouch made from a section of the intestine that serves as a substitute bladder. The ureters are then connected to this pouch, and the pouch is connected to the skin through a stoma, which requires intermittent catheterization to empty the pouch. Another option is an incontinent urinary diversion, where the ureters are connected to a segment of the intestine that drains directly to the skin through a stoma, requiring the use of an external collection bag. Additional surgical procedures may be necessary to correct any associated anatomical abnormalities, such as vaginal or rectal prolapse. Lifelong monitoring and management are crucial to prevent and treat complications, such as urinary tract infections, kidney damage, and electrolyte imbalances. Due to the developmental nature and rarity of bladder agenesis, there are no known methods for prevention. As the precise cause is not fully understood, prenatal interventions specifically aimed at preventing this condition are not currently available. General recommendations for a healthy pregnancy, such as avoiding exposure to known teratogens, maintaining a balanced diet, and receiving appropriate prenatal care, are essential for promoting overall fetal development. Genetic counseling may be offered to families with a history of congenital anomalies, although the low recurrence risk of bladder agenesis often makes it less relevant. The prognosis for individuals with bladder agenesis varies depending on the specific anatomical abnormalities, the success of surgical reconstruction, and the diligent management of potential complications. With appropriate surgical intervention and lifelong follow-up care, many individuals can achieve reasonable quality of life. However, chronic kidney disease, urinary tract infections, and the need for ongoing surgical procedures can impact long-term health. Recent research efforts are focused on improving surgical techniques for urinary diversion and developing bioengineered bladders that could potentially replace the missing bladder in the future. These advances hold promise for enhancing the lives of individuals affected by this rare and challenging condition.